The biggest question we get at Affordable Medicare Solutions is, what's the difference between original, traditional, classic Medicare versus all of these new modern Medicare plans called Medicare Advantage plans? Well, there's a lot of differences, and each one could be positive or there could be a negative, so you have to pay attention to the differences. But think about it in a simple way. If you want to prepay for your medical care and have full choice on where you go, just use traditional Medicare. That's where you have Medicare with a Medicare supplement or Medigap plan, same thing, and then you have a drug plan. Pretty clean and simple, but you're prepaying for your medical care by sending money off to an insurance company. They are then required to pick up the rest of your bills. Pretty simple. Now, if you want to use a great Medicare Advantage plan, there's different types. HMO means a mandatory, maybe smaller network than a PPO plan, which means a preferred provider option. So think about when you were working at your job. They would present to you every year, maybe choose a plan. You had to check a box, HMO or PPO. It's the same thing that's happening with Medicare Advantage. You would choose, do I want a closed network or do I want an open network, maybe a national network of doctors and hospitals, and that's called a PPO. But this is not prepaying for your health care. Most of the Medicare Advantage plans have a zero premium. How is that possible? Medicare subsidizes the company, so don't worry. But your costs do go up if you got sick. Instead of prepaying for your health care like you did under traditional Medicare with a supplement, now with Medicare Advantage, you'll pay a copay for every event. If you go to the hospital, it might be $350 each day you're at the hospital for a week. After that, it might be free. But it might be a total, if you got sick multiple times that year, of $8,000 out of your pocket. Every year that can change and every plan might have a different number. So be very careful to understand the differences. But a lot of people are choosing Medicare Advantage because there's an imbalance right now. Under the Advantage system, the government is allowing dental, vision, hearing aid coverage. They're allowing free groceries to be given in certain circumstances, maybe even help at your home, or paying to have vitamins or other items that you need like adult incontinence products. Regular Medicare does not do that. So a lot of the Advantage plans are being sold on those extra benefits. Do not buy a plan based on extra benefits before you've verified that your doctor is covered, your hospital, your pharmacy, and your drugs are covered. Then a secondary consideration will be, do I like these additional extra benefits, and do I mind that I have to pay each time that I'm accessing health care? So what we have for you is a flyer that describes all of these plans in a very summary description. It's a 2-page flyer. And what's nice is you can download it, but you don't have to learn all this by yourself. Just call our office. We'll set a time to go over the differences. And we also have a great YouTube channel that has a class that explains this in much deeper detail.